So previously, profitability was the only benchmark or the key of success that was measured for most of the companies. But now with the ESG coming into play, sustainable profitability which is environment friendly and which is socially sustainable with good governance. These are the most important things for a long-term sustainability of the any organization.
Welcome to another episode of FaceTime with Leaders, a podcast series by Directors Institute World Council of Directors. I'm Priya George, and today we are in for an exceptional conversation with one of the brightest minds in the field of oncology, Dr. Vindhya Vasini Andra. In today's episode, we are joined by a distinguished medical professional whose career exemplifies the true essence of dedication, expertise, and leadership in advancing cancer care. But this episode isn't just about incredible accomplishments, it's about transformative journeys and the power of education that shapes those journeys. Get ready to be motivated, challenged, and enlightened. This isn't just about a career, it's about a vision that's reshaping lives and driving the future of healthcare. Dr. Vindhya, you built an incredible career that spans multiple continents. So we are so glad that you have decided to join us today on FaceTime with Leaders. We welcome you to our show.
Thank you. Thank you for having me today.
Right. So let's get straight to our conversation. Dr. Vindhya, looking back on your journey from your early days of studying medicine to becoming a leading oncologist and educator, what were some of the most defining moments that not just shaped your professional path, but also fueled your passion for making a difference in cancer care?
Yeah. Thank you for asking me that interesting question. So, when I started out as a MBBS student in my second year of postings, we have a posting in the community medicine department, which deals with the how diseases are present in the community, what is their incidence, and what are the causes for these diseases. So
Right.
as a part of our project work, we had an ICMR project, the Indian Council for Medical Research
Yes.
project. Under this project, we had to collect data of the health status of children under 5 years. So for this, we had to go, or we used to go to the urban slums of our city. I was doing it in Vishakhapatnam. So
Okay.
there we used to go to the Anganwadi centers, and the social workers used to help us understand how these children are monitored and what is their nutritional status, how is the nutritional status improved, and at the same time how the mothers are educated about the importance of nutrition in a growing child and how it affects their development. This is how I had first hand experience of a community medicine or health care in the society. So until then, we were doing our bookish studies, and we were limited to the books and the knowledge in the books. So that experience stimulated me to, go into the society, understand more about various diseases. So similarly, we had another project taken up by the WHO, World Health Organization, which was evaluating how head and neck cancer incidence is different in our area, that is the north coastal Andhra Pradesh, compared to other areas in the southern India. So
Okay.
here, the peculiar part was in the north coastal Andhra, the smoking habit. There was a peculiar habit of keeping the burning end of the cigar into the mouth. So they used to keep
Oh,
the burnt end. Usually, the burning end is outside, and they
right.
take in the smoke. So here they used to keep the burnt end inside, and there's a constant irritation of the hard palate. So there was an increased incidence of hard palate cancers in the that region. So this project, I think this was the seed or the trigger for my interest in oncology. So from there on, I researched what this field of oncology was and what are the various sub specialities and how it was transforming or improving, or how this newer technologies are increasing the scope of oncology. That is how I got interested in oncology.
Right. Which actually you've answered the question that came to my mind when you were talking. Why oncology in particular? And you have answered that. So thank you for sharing that with us. And so moving on, now you've had the incredible privilege of working with some of the most renowned cancer care institutions across the globe. And each of these institutions have their own unique approach to treatment. Now, Dr. Vindhya, as someone who's witnessed these diverse methods and outcomes firsthand, how have these experiences influenced your personal philosophy on patient care? And on a deeper level, how have they shaped the way you approach your own research, knowing that each patient's journey is very different?
Yeah. So I had the privilege of working in various setups of cancer treatment, starting from a government institute where the patient burden is very high, that we used to get 200, 300 patients every day. And the facilities were bare minimum. There were not enough infrastructure that could handle such huge patient load. And we had to make ways to use the best of the resources available to achieve the best possible outcomes in these patients. And then
Right.
I also had the experience of working in a autonomous institution which has good funds and also caters to a huge geography. Like I did my DM in SWIMS, which is an autonomous university in Tirupati, and it is well funded by the TTD, the Tirumala Tirupati Devasthanam. And
Got it.
they have lot of patient support and patient centric programs which funded even very, very costly medicines. Like there were some targeted therapy and drugs which costed 4 to 5 lakhs per dose, and we were fortunate enough to give our patients such high and effective treatments. And also
Right.
the entire southern region of Andhra Pradesh was covered under this institute. It was a research centered institute where we developed indigenous way to detect certain mutations in genes which were known to cause cancer. So we developed our own method to detect these genetic mutations, so that we can warn these patients that they will be
Got it.
having an increased risk of cancer. And right now I am working with Omega Hospitals, which is a cancer specialty tertiary care center, which is a private hospital. It is equipped with the world's best technology, I would say, AI-powered linear accelerators, PET
Wow.
MR, which is the first of its kind in India. And all these latest equipments, I am fortunate to be using. And also, we use the latest molecules or chemotherapy targeted
Right.
immunotherapies, antibody drug conjugates, CAR T cells, transplants to improve the survivals of our patients. And my experience across all these types of institutes and also collaboration with several research centers in the United States, and there are even centers which are researching on the molecular genetics in cancer,
Right.
which are collaborating with us. And this is how we are trying to understand more about cancer, its causative factors, and how we can improve upon the treatment to
Got it.
uh, prolong the survivals and increase the chances of cure in these patients. It is a very exciting times in oncology, I would say.
Right. Right. Thank you so much for your response. Now, the next question came to my mind when you were responding, slightly off script. Suppose there is a patient who has been recently diagnosed with cancer. As a doctor, an oncologist, what do you think are the three most important things the patient and his family needs to start with before or during the treatment, or three things that people don't really discuss, or what can help a cancer uh, patient? Yes.
So the most important thing is what to expect from the treatment. And that depends on the type of cancer and the stage of cancer.
Stage.
So definitely earlier the stage at which it is diagnosed, better would the outcomes results be. Second thing is what they should do during the treatment. So concentrating or improving their nutritional status, their being stress free, discussing
Correct.
with the treating physician and also the caregivers about what doubts or whatever apprehensions they have. So many a times we see patients are too scared to even ask very basic doubts because
Yeah,
they are afraid that they might have to listen to a negative answer or a very bad news. So
correct.
they try to shy away. Or sometimes, most of the times, especially in our country, we see that the caregivers, the patient's husband or wife or their mother or
Right.
children, they want the patient to not know the diagnosis. So I think slowly we
Hmm.
should make everybody understand that knowing what is bothering them or what is the diagnosis and what is the treatment that they need, this would improve not only the chances that the treatment would work better, also the compliance from the patient, because many a times the patient doesn't know the seriousness of the issue and they simply refuse treatment, and it becomes very difficult on the part of the oncologist to convince the patient to go ahead for the treatment. And
Got
yeah,
it.
of course, concentrating on nutrition, sleep, and being stress free. I always counsel my patients to have at least 6 to 7 hours of undisturbed sleep, and also meditation helps with. There are several studies
Absolutely.
which have shown that meditation, regular meditation and exercise would improve their tolerance to therapy.
Absolutely. Thank you. Thank you so much for your response. Moving on, Dr. Vindhya, your work on breast cancer, particularly with HER2 positive cases. Now, for our listeners and viewers, HER2 basically stands for human
Epidemic.
epidermal receptor. Uh,
Two.
I think human
New
epidermal
is neuron.
recep- receptor genes,
Yes.
right? So has truly been groundbreaking. And it's clear that your contributions are helping to change the way we think about treatment. Now, when you look at the progress made so far, what are some of the most exciting breakthroughs or insights you've uncovered that you believe could really transform the future of breast cancer treatment?
So, when we talk about breast cancer, we should understand that breast cancer is not a single disease. It is at least four types. And based
Oh,
on the expression of several receptors, like the hormone receptors and the HER2 receptor, which is a growth receptor on the tumor surface, the breast cancer is divided into four types. And
okay,
of these four, HER2 positive breast cancers and triple negative breast cancers are very, very aggressive, and
okay,
the survivals in these patients is very was very minimal rather.
okay,
And in when a patient was diagnosed with a HER2 positive stage 4 breast cancer, say 2 decades ago, we would have given a survival of 6 months to 8 months. That is how bad that disease is. But now,
okay,
with the better understanding of the biology, better understanding of how this HER2 receptor works, and with the availability of various targeted therapies, which go and target and block these receptors and thereby causing the cancer death. We
Mhm.
have tremendously improved the survivals of these patients. And even stage 4 HER2 positive breast cancer today, if a patient is diagnosed with a HER2 positive breast cancer, um, most of these patients, many of these patients, they survive for at least a decade now. Like it was
Wow.
unheard of or unthought of, say 10 years back. Now with lot of newer drugs, newer molecules, better understanding of the tumor biology and how it evolves over time, we have several targeted therapies, immunotherapies, antibody drug conjugates, the newer CAR T cell therapies, which have improved the survivals. And I myself have many patients who were diagnosed with stage 4 HER2 positive breast cancer,
Wow.
presenting with brain metastasis, surviving for the past 7, 8 years, and they're doing quite well, normal, leading normal life. They just come once in 3 weeks for a small injection and then go home without any side effects. So that seeing such patients, I don't think nothing else gives more satisfaction.
Absolutely. I can imagine. And it's so inspiring to hear how these breakthroughs are not just changing treatment, but really transforming lives.
Yes.
Um, Dr. Vindhya, as someone who's not only an expert in oncology, but you are also a dedicated faculty member at Omega Hospitals. And you've seen firsthand how medical education has evolved over the years. From your perspective, what changes or improvements have you witnessed in the way oncology is taught?
So when I was doing my residency, I did my MD in radiation oncology, then DM in medical oncology. So since 2008, I've been in oncology. And I've seen when I was in residency, the access to information, access to various articles or the recent conference updates was very difficult because, internet
Right.
was only starting just then. And
Yes.
there was a lot of roadblocks in accessing. But now all the residents, everybody has easy access to the
Access.
information out there, and the transfer of knowledge is quicker now. And there are a lot of communities online, the medical oncology communities, radiation oncology
Right.
communities, which are conducting classes, like nationwide classes, online classes. There is a certain time where faculty from all over the country, be it AIMS or all institutes, they
Yes.
teach every week. So staying in a particular institute is not a restriction to access the faculty in other institutes. So now it's like
Absolutely.
as good as being in AIMS or any other institute, even if you are
Yeah.
in remote place. And the interaction or the enthusiasm with which the residents or the students are coming up with newer projects, they are more involved in the patient care. They research when a patient or when a very a rare case comes up, they do research on their own. They come up with their treatment protocol, how they would treat, and discuss with the faculty. And that is how we have improved. And also there is more emphasis on research and paper presentation. Many of the students now, they go to international conferences. So when I was in residency, doing my DM, I did a project on Hodgkin's lymphoma, the incidence of Hodgkin's lymphoma in our institute, and my paper got accepted in the international conference on Hodgkin's lymphoma at Switzerland. But unfortunately, because of lack of enough financial aid, I was not able
Okay.
to attend in person. But
Oh,
now we have lot of forums, medical oncology forums or medical forums, which help students attend these conferences. Even the conferences give discounts,
scholarships.
yeah, scholarships to attend, and also present their data. That way there is more encouragement for the upcoming newer oncologists.
Absolutely. Yes, that's very heartening to hear. And Now, Dr. Vindhya, when you think about the biggest hurdles in raising public understanding of, issues such as uh, spreading the message of prevention, early detection, what strategies have you found to be most effective in reaching people and encouraging them to take action?
So now I believe in this age of social media, we have all been using social media to reach out to the masses, be it in the urban areas or in the remote rural regions. And we have also tried to make it more interesting because obviously people they tend to bend towards more interesting stuff, like someone is cooking, they are willing to watch the video. But when we are trying to bombard them with this news of cancer, how to detect, one thing they are scared, second
Yes.
it is boring. So we try to make it more interesting by
Yeah.
we did a project, we called a social media influencer and try to have a chit chat. It's like a chit chat with her. That's how
Right.
we try to put in some of these awareness messages
Correct.
within this chit
Correct.
chat. And we also did a campaign last year on the metro station, metro rail train,
Hmm.
when
Hmm.
a video about the liver cancer, how it affects, it is being played. So there was a very good. So I was giving a explaining about the how to detect liver cancer, what are the risk factors, how to reduce the risk factors for liver cancer. And there
Hmm.
was a lot of positive vibe, and many patients, after seeing those videos, they approached our institute, and they got their screening done. A lot of breast cancer awareness campaigns that we have done.
Right.
We have personally did done campaigns, cancer awareness campaigns, and also screening campaigns in several large industries. And many women, they were enthusiastic and they participated in these screening programs, asked lot of doubts. Then they took lot of inputs, and they even came back for the follow-up screenings. And
Hmm.
the one message that I give to wherever I go for these campaigns is to I request them to spread this message among their friends, family, and
Right.
colleagues, and whichever kitty parties, whatever small gatherings they go, so that this knowledge sharing happens, and ultimately majority, or it passes through majority of the people, and also it reaches to the target audience who need to be aware of this. So because whenever we see breast cancer patients in our country, around more than 50% present with an advanced stage. And breast cancer detection is actually easy because it is a very easily palpable area. But
Right.
because of lack of awareness, the number of patients who present with an advanced stage is very, very high when compared to the West. In West, there is a very good system of screening which is taking
Hmm.
place, and 80 to 90% of the patients, they present at a very early stage, which is only detected by the mammogram, and there the cure rates are more than 90. And
Right.
in our country, where 50 to 60% present in stage 3 or stage 4, and most of
Right.
the time there is increased chance of recurrence. So and now breast cancer is the most common cancer among men and women world over. When we take all the cancers in men and women together, breast cancer comes as number one.
Wow.
And it is not preventable, but it can be detected very
True.
early, and the
Yes.
cure rates can be significantly improved. So I think
Yes.
a lot of work needs to be done in increasing the awareness about the breast cancer detection.
Right. Right. And speaking about breast cancer, Dr. Vindhya, um, so these women who who get detected with breast cancer, I have heard that there is a study which shows that women who are unable to conceive or choose not to have children,
Mm.
please correct me if I'm wrong, are they more susceptible to breast cancer? Is there
Yeah,
uh,
there it is a known risk factor which increases the risk for breast cancer, nulliparity. So having no children or having children above 30 years of age or not breastfeeding the children are known risk factors for breast cancer. But having said that, it is not that women who don't have children will have breast cancer. All the breast cancers that we see, 95% are women who had children breastfed and they had children at a young age. So there
Got it.
are multifaceted causes for breast cancer.
Got it.
And one of these is nulliparity.
Okay. Right. Thank you. So that was a question that came to my mind. Moving on, Dr. Vindhya, with everything you've already accomplished in your career, which is a lot, what are your aspirations for the future of oncology, and how do you see your own role evolving in the years to come? Are there any specific goals that you're particularly excited to pursue in the next phase of your journey?
So, as a very famous oncologist once said, a successful oncologist is one who doesn't have patience. That means we have to increase the awareness of cancer so much that all the risk factors are reduced to the minimum and the incidence of cancer comes down. So, as an oncologist, I would want the knowledge or the what would I say? I would want everybody or the majority of the population to know about existence of cancer. Many a times we see patients who don't know that there is an entity called cancer. They
Right.
so ignorant. And then the first hurdle is knowing cancer. Second is knowing when to get screened, knowing the signs and symptoms of cancer, and knowing what could cause cancer and reducing those risk factors. So we as an institute, we adopted several villages around our place in Hyderabad, and we conduct regular cancer screening camps, cancer awareness programs in these villages and smaller villages around them. And we gather these people on a particular day every year, once or twice in a year, and then we conduct these screening programs and awareness camps, and that is how we are trying to improve the awareness. And also I work with several NGOs and the Rotary Lions Club to organize these cancer awareness camps in smaller organizations, and also several schools and colleges where young minds need to be made aware of the ills or harms of cancer and how to detect and what can be done to reduce the risk for the development of cancer. So my aim or what I want to achieve in future is to be a champion of cancer risk reduction, awareness of cancer and cancer screening. A lot can be done because India being a vast country with limited resources, leaving everything to the government alone cannot solve it. We as citizens, responsible citizens, should pitch in our efforts and give in our time to improve the healthcare of our citizens. And also, not only in India, we have several underdeveloped countries in the Eastern Africa especially, wherein we are collaborating with their governments and trying to improve their healthcare systems. We have a lot of patients coming from Eastern African countries, and we are trying to have a knowledge sharing, capacity building in their countries so that the healthcare facilities, especially the cancer related healthcare facilities, improve in their countries. And we will be able to do our bit in helping them grow in that way.
Right. I'm sure it'll work out, and all the best for your future endeavors with your determination and passion. I'm sure that is something that will definitely happen for you in the future. So all the best for that. And as we near the end of our interview, Dr. Vindhya, ESG is a rapidly evolving area that's impacting industries across the globe. In your view, what are some of the key challenges and opportunities that ESG presents? Why do you think it's crucial for industries to adopt these principles moving forward?
So previously, profitability was the only benchmark or the key of success that was measured for most of the companies. But now with the ESG coming into play, sustainable profitability with which is environment friendly and which is socially sustainable with good governance. These are the most important things for a long-term sustainability of the any organization.
True.
And me being an oncologist, I am more worried definitely about the environmental part of the ESG, wherein there should be a environmental friendly resourcing of the sourcing of the resources of the institute or the organization or the industry. Like we have these Havells industry, which now it has made sure that there is no radioactive isotope in its ceramic lights, and there are
Okay.
several other industries which are now going green. They are reducing their carbon footprint, which is very essential for the sustainability of our future on this earth. And when we look at
Absolutely.
the social responsibility, uh, the um, the social measures that previously there was only the CSR, corporate social responsibility, but now the ESG has overtaken this. And many in industries, the very corporate organizations, they are coming up with various scholarship programs for young bright minds to encourage them to enter into challenging fields. Then there are certain organizations under these industries which are catering to the less privileged uh, population, like improving the sanitary conditions of the slums in
That's
various
true.
urban areas. And also, when we look at the governance part, the improvement in the transparency, especially when we look at the board make up there is the mandatory presence of independent directors and women independent directors in the board. These all have made sure that the confidence of not only investors but the consumers and the suppliers improves, and the functionality and the working of these industries improves, thereby reflecting in a better output and profitability of these industries.
Right, right. That's a very interesting perspective. And it's clear that you see the bigger picture and truly understand the power of ESG in shaping a better world. As we come to the last question in our interview, Dr. Vindhya, as someone who has had the opportunity to engage with Directors Institute, how has your experience been so far? And could you narrate some key takeaways or skills that you have gained from the program?
So before I enrolled in the program, I was very skeptical what it would hold for me, as someone from a medical background who has
Absolutely.
minimal exposure to the corporate world. So I am very grateful and in fact thankful that I could make the right decision of contacting the Directors Institute and enrolling in this program. And the very structured way in which this program is planned, and it is and also we have these weekly live classes with a very well-known, renowned person who gives us insights into what to expect when we become an independent director, and what are
Right.
all the nuances and what we need to concentrate on. All these have definitely improved, and they have changed my perspective on not only pursuing this particular career, but how I approach in my everyday life. This has changed, and how I approach in my institute, how I deal with various situations that
Hmm.
come up in my institute, with the patients, with the nursing staff, with the supporting staff, everyone.
Governance,
Yeah,
everything.
there
Yeah.
was a all-round change in my approach to several situations, how I handle these situations.
Right. So your learning was made more holistic, I think,
Holistic.
if
Yes.
I may say so. So, Dr. Vindhya, thank you for being with us. It's been such a pleasure having you on the podcast today. Your insights and experiences have been truly inspiring, and we are grateful for the time you've taken to share them with us. And I'm sure our listeners, our viewers will take away valuable lessons from your journey and your perspective on both the medical field and the importance of ESG. Thank you once again for joining us.
Thank you, Priya.
And to our listeners and viewers, thank you for tuning in today. We hope you found this conversation as insightful and motivating as we did. Stay connected for more stories and discussions with leaders who are making a difference. Until next time, take care and keep striving to make an impact in your own unique way. Until next time, thank you.